Well, I think most importantly, providing the data in a digital format that's connected, that's interoperable, so it can move around, allows data to be presented at the point of care at the right time when it can be most helpful to improve the patient care. So the biggest impact, frankly, is for the patients, because all the repeated studies that happen or the missing information, all of that goes away. On the administrative side, what happens is you can get a lot more efficient. You can try to figure out what are best practices. How can we make things better? You can do what every other industry has done, which is use information to make itself better with a higher level of productivity. I think there are a couple of big opportunities, and it's a little bit regional, a little bit depends on the country and whatnot. But I think one big opportunity is, as I said, interoperability or interconnectivity. We have a lot of different systems that are out there today. They're not well connected. Even here in Canada, where you have the Health Info Way, it's not as well connected, and very often the nursing data doesn't connect to the physician who might be in their office, or connect to the hospital where the patient might show up in the emergency room. So we're not getting that benefit that we could get. So that's one, is connectivity, interoperability, et cetera. And the second, I think, is to use the power of the cloud in healthcare to move data to a more secure environment where it is more easily available, and where it can be more easily moved to the point of care in a much more efficient way. So I think there are a couple of barriers. First of all, I don't think the barriers are technological. On a sort of base technology level, we know what has to be done. We could always get better, but we kind of understand a lot of it. I think the barriers are financial and political and cultural. Financial is, this stuff costs money, and every government is trying to figure out, how are they going to cut their budgets, how are they going to deal with the recession and all these other issues. So money is tighter than perhaps we would like. Two is the political, meaning organizations have to agree to change. Change is a hard thing. Changing how we do things, changing the way we take care of patients, changing the actual workflow within a hospital, let's say. All of that has to happen. That's a political, or maybe even a cultural, I guess, change. And those are really the harder changes. It's actually even easier to get the money sometimes than it is to get people to change how they've been doing things for X number of years. And by the way, I want to say that change in healthcare is a good thing, but something we always have to be careful about, because we don't want to just change willy-nilly. People's lives are in the balance here, and we want to make sure that the change is going to be beneficial. I think the next step is to, again, focus on adding value to the information technology as it gets developed, working on the workflow changes, the process changes, moving things into a more mobile environment. For example, we at Dell have 400 clinicians who go out into hospitals and don't install systems. We have different people who do that. They actually just help the doctors and the nurses and the caregivers use the system better, get more out of the system, so that it makes their workflow better, makes them more efficient, frankly reduces their stress, all of that kind of stuff. Those are the kinds of things that will enable those cultural, those political changes that I mentioned before. We are focusing a lot on the cloud, as we talked about before. I think that moving data to the cloud, we have 6 billion radiology images in our cloud in the U.S., and we're rolling out a similar cloud here in Canada. Why? Because people are tired of having to worry about data centers and build data centers to manage all of this increasing information. And when you start to think about genomics, you're talking about huge data sets that are very hard for people to manage. They'd often fill up a data center pretty quickly. And the point there is, and I guess this is the broader point, is the IT resources, the local IT resources in an institution, whether it's in Canada or in the US or elsewhere, should really be focused on how do you add value? How do you do something that's specific to your institution? Having somebody sit around and make sure the server's up and running is frankly not a value add. It's kind of a core infrastructure. And if you can give that to somebody else at a reasonable price and focus your efforts, you as the organization's efforts, on how do I help my doctors, how do I help my patients get access to their own data, how do I look at populations of patients to see if we can improve this group of diabetics and how they're doing, that's really where you as an IT professional add value. The security issue, as I mentioned earlier in the presentation, the security and privacy issue is one of the critical issues, in my opinion, in healthcare information technology right now, because we're not paying enough attention to it. Everything from encrypting a hard drive or a thumb drive or whatever, all the way up to securing and making sure that hackers are prevented from intruding into the system. Because patients trust us with their data. Patients expect us to keep their data private and secure. And our laws, both in the U.S. and Canada, punish, frankly, us if we don't do a good job of doing that as healthcare organizations. So this has to be a priority. And it also has to be a priority, again, because we want to expand things, and we want to make things more mobile. We want to bring data closer to the patient. And we want to bring that data in a way that is easily accessible for both for the caregiver or for the patient. And one of the things that Dell has, for example, is a Windows 8 laptop that has a fingerprint reader and a smart card reader in it. Why do we have that? Because that way we can make sure that device is more secure, because you have to put your smart card in. It's not just a password that you may tell somebody or you may write down on a slip of paper and then somebody else can get into it. You actually have to have the smart card or your finger to get into the device. So that increases the level of security so people can feel comfortable that what they're doing is going to be appropriately secured.